My name is Dr. Simon Middle, and I work as a medical consultant as well as a certified medical director in post-acute care. And we are here today to talk a little bit about the COVID-19 vaccine and address some of the concerns that may arise from getting the vaccine. Let's start off by just talking a little bit about the vaccine itself. This is a brand new type of vaccine. It's called an mRNA vaccine. And the advantage of that is that there are no particles of virus in the vaccine at all. So you cannot get COVID-19 from the vaccine itself. So I think it's important to recognize that, and that this type of vaccine actually allows your body to develop a protein called a spike protein in your system, which your body then reacts to and forms two types of immunity, both in terms of antibodies, developing antibodies, but also developing a memory in your immune system through the cells of your immune system to then be able to produce that antibody in the future if you were to be exposed. It's a very, very effective vaccine. It's over 95% effective, which is an amazing number. Most of the time, our threshold for vaccinations is between 50 and 55% effective. So to be over 90% effective is really unheard of. And it's an amazing feat of bioscience for us to be able to do that. We do know that getting vaccinated is the best way to protect yourself and those around you, not only for yourself, but for your family members, for the residents and the patients that we serve, as well as your coworkers. And so when we think about the impact that COVID-19 has had in terms of illness, in terms of death, in terms of workforce, and workforce shortage, we know that it has had a significant amount of impact. And although we know that wearing masks and social distancing have been significant in helping us curb that infection, we obviously are still seeing a high number of infections and a high number of deaths. And so we really want to make sure that we do everything possible to try and get back to some sense of normalcy in which we don't have to isolate. Families can get back together. Society can enjoy going to restaurants or being able to do entertainment activities. And we know that COVID-19 has really restricted that. This vaccine is our best chance to be able to get back to some normalcy. And so again, we really are encouraging especially healthcare workers to get vaccinated. The CDC has had a number of conversations about the priorities of vaccinations, and we do know that based on the science that's out there, that healthcare workers are at one of the highest risks of infection, illness, and loss of work, and has significant morbidity associated with that. And that illness can be quite prolonged. And so anything we can do to protect healthcare workers is incredibly important. You have probably heard about some of the shortages in work staff, but also the incredible limits that we're pushing our hospitals and what we're seeing even in the post-acute care environment, especially in our nursing homes and in our assisted livings, in terms of how do we manage and how do we take care of the people that are in our facilities. So again, we really believe this to be an important consideration. You have probably heard the term of emergency use authorization, which is the mechanism in which the FDA will most likely approve the two vaccines that are currently available, one by Pfizer and one by Moderna. We expect that to go through. And what does that mean? It basically means that we have reviewed information, the science, the studies that have been done, and due to the public health emergency that we're currently in, the FDA can approve under emergency use authorization medications that and vaccines that can help in this public health emergency. This is how some of the medications you may have heard of that are being used in the hospital, remdesivir, corticosteroids, have been approved under this because they have demonstrated some efficacy in reducing the burden of illness associated with COVID-19. So although it is a shorter process, it is really important to understand that safety is not compromised. And as we talk about COVID-19 and the development of its vaccine, we need to realize that, number one, we have had more people tested with this vaccine prior to its release than most other vaccines. And so it has a very significant improvement in its safety profile and its understanding of safety than most vaccines. Number two, it's important to recognize that the FDA was not going to approve any vaccine without 2 months of safety data. So why 2 months? The main reason is because when we look at long-term implications of vaccines, almost all those symptoms will occur in the first 2 months. Now, we currently have 3 months of safety data with vaccination, and so we have had no change between the 2-month data and the 3-month data that indicate any other long-term implications. Now, obviously, we don't know for sure, and so the question always comes up, well, what if? And that's a legitimate question, and we need to be aware of that. However, you know, all of the safety data has been very, very positive. So we need to kind of keep that in mind. Again, there is no risk of actually getting COVID from the vaccination. Again, as I described, it does not have any viral particles inside the vaccine itself. The current side effect profile that we're aware of is primarily headache, fatigue, muscle aches. You can get a low-grade fever, pain at the injection site, or swelling at the injection site. Those would all be very normal signs of side effects that we would expect. Anything outside of that should be reported immediately, but we are not seeing that in the studies that have been done so far. We know that the current vaccine requires 2 shots, and we know that side effects are more common with the second shot than they are with the first shot. The first shot is usually done, and then about 21 to 28 days later is when your second shot is done, and your full immune system is sort of primed about a week after that second shot. So about a month after your first shot is when you're fully vaccinated and fully immunized, if you will. So I think the biggest concern that I'm hearing about is really around safety. This has been a vaccine that's developed very quickly. Again, new technology being utilized. Again, more people have had this vaccine prior to its release than any other, most other vaccines. The minimum requirement to assess safety from the FDA is 3,000. We have almost 50,000 patients who have underwent vaccination prior to its release in the safety studies. And again, the safety milestones that were established by the FDA have been achieved. And so we feel very confident that this was well tolerated across many populations, many ethnicities. And so there's really been no serious safety concerns that have been observed. So even though it was created faster than normal, I want to assure you that safety was not compromised in this process, and effectiveness is incredibly high. And we know that, again, for us to really get back to a sense of normalcy, vaccination becomes very, very important. We knew that the timeline was going to be shortened because of the urgency of the situation in the current public health emergency. And so we do have mechanisms for reporting if there are concerns about safety. We also note that the vaccine has been evaluated by 2 advisory committees. The first was the Vaccine and Related Biological Products Advisory Committee, or VRBPAC, which advises the FDA, and then also the Advisory Committee on Immunization Practices, which advises the CDC. These are independent boards, and their job is specifically to monitor for any concerns of safety, regardless of politics, regardless of financial concerns, regardless of, but really purely looking at the science. They are experts at academic institutions, and they are vetted to really avoid conflicts of interest. And they have provided insight into for both the CDC and the FDA, who both have supported the administration of this vaccine. So again, we know that this vaccine is really unlike other vaccines. It doesn't have any live viral particles, doesn't have any killed viral particles. And so again, we believe that getting this vaccine is very, very safe. The symptoms that we are seeing, again, the muscle aches, the fever, chills, headaches, are really signs of your immune system reacting to the vaccine as we would want it to. And so if you do have symptoms, it doesn't mean something's wrong. It's actually very normal. So how effective is it? We talked about some of the recent data. Again, the FDA's goal for vaccine effectiveness is 50%. Both the Pfizer and Moderna vaccines are around 95% effective, which is significantly higher than what we have seen with most other vaccines. We know that this has been observed across all populations. And Dr. Paul Offit, who's a pediatrician specializing in infectious disease and considered an expert in virology and vaccine development, has said, quote, "The choice not to get a COVID-19 vaccine is the choice to be among the almost now 250,000 people who have died from this virus." End quote. Not getting vaccinated is a radical choice, and we want to make sure that you have the best opportunity to get this vaccine and to have your loved ones get this vaccine and our residents to get this vaccine, so that we can all be protected around a vaccine, or excuse me, a virus that has been deadly and continues to break records every day in the number of people being infected and the number of people dying from this virus. One of the big questions that's out there is, how long is the vaccine effective for? And that is actually not known at this time. The recent data has shown that we know that as we get further and further out from the administration of the vaccine in the studies that have been performed, that the immunity has been lasting at, and that's been about 3 months at this point. So we don't know if we're going to need additional booster shots in the future, such as we do with tetanus, but that may be a possibility. And as we get more information over time, we want to make sure that you have that information easily available to you, so that you can make the best decisions for yourself, your family, your loved ones, and for the populations that we serve. So when will it be available? It's really not sure. We're expecting the end. Today is December 8th. We're hoping by the end of December that the first doses will be available for healthcare workers and for skilled nursing facility residents. We know that by early 2021, that should be more available. And so we are working very hard in developing protocols around how to screen, how to effectively immunize in combination with our pharmacy services, so that we can make sure everybody gets the opportunity to get vaccinated. The current vaccines, both the Pfizer and Moderna, require 2 injections. We know that the second injection is usually given about 21 to 28 days after the first injection. And a lot of that depends a little bit on the manufacturer, and as we get the emergency use authorization, some of the guidelines that the FDA will give us. So one of the questions I think that comes up often is, if I've had COVID-19 or shows that I have antibodies, should I get the vaccine? So what we know is that the COVID antibodies from a natural infection don't necessarily last as long as we'd like. And so that we do believe that people who have had COVID or have demonstrated COVID-19 antibodies by testing should continue to get a vaccine. And the reason is that we believe that it protects longer and more effectively. We know that there are cases of repeat COVID infections. And so we want to, again, make sure that you are protected to the best of our abilities with the science that we know at hand. So again, side effects we've talked a little bit about. It will not make you sick with COVID, but you might feel some body aches, fever, chills, headaches. Some people will get some nausea, occasionally some diarrhea. the site where you get injected might swell, might be painful, but that's really what we're seeing. And again, usually works with the second injection versus the first injection, but both injections are needed to really be fully immunized. Long-term effects are being studied, and so we now have 3 months of data, and we know there are no severe side effects. And again, any vaccine that's produced, all are monitored for 10 years in terms of evaluating for long-term effects, and the same will be true for this vaccine. What about the flu shot? It's really important to get the flu shot. We do know that people who get the flu are more likely to get COVID. And so again, both vaccinations are recommended. There should be about a 2-week gap between your flu shot and your COVID vaccination, according to the guidance given to us by both the CDC and MDH. And so we want to obviously follow those guidelines. So what about, what should I do with PPE? What should I do with testing, screening? At this point, we are going to really highly recommend that everybody continue with PPE and that you continue to get tested. And the main reason is because the length of time that the time it takes for your immune system to actually get to full speed can take up to a month. Now, I anticipate that we'll get more guidance around this from the CDC, from the FDA, and from Minnesota Department of Health. But as for right now, our expectation is to continue to use PPE and to continue to be tested. One of the questions is, who's going to pay for it? Well, at this point, we believe that there will be no cost to you for the vaccine, either for yourself or for residents. And so, again, we want to eliminate any barriers that may be present to really encourage you to use this. One of the biggest concerns is really around how dangerous is COVID-19. We know that for older adults, your chance of being hospitalized if you're over the age of 85 is 13 times higher than the general population, and it's 630 times higher that you will die from COVID-19. If you're in the age group 75 to 84, the risk of hospitalization is 8 times higher, and the risk of death is 220 times higher. If you're a bit over the age of 65, between the age of 65 and 74, you're 90 times more likely to die and 5 times higher to be hospitalized. So again, if you think about the populations we serve, the loved ones you have at home, we know that our risk of transmitting that is relatively high, and the best way to protect ourselves is really with this vaccine and with immunization. So we do know that natural immunity does exist if you become sick with COVID-19. And our system tries to remember, but we don't know if becoming sick with COVID-19 actually causes you to be immune to reinfection. And again, as I said earlier, there are cases that have really identified that there are cases of reinfection. We do know that, or at the current time, the science would show that the immunization is very effective. It can be helpful in really eliminating that risk. So there are two different types of vaccines out there. One is from Pfizer and one is from Moderna. And so they are different in how they are stored. And so, your facility may be deciding which vaccine, but I will tell you they're both very effective, and they both they both have very safe profiles to them. As we end here, my encouragement is for you to strongly consider getting the vaccine. It will help all of us. We all need to be vaccinated. It's really important that for ourselves, for our loved ones, for those we interact with, for our coworkers, and for our residents, as well as what the impact has been on COVID-19 for our economy and for our society. So I strongly encourage you to be vaccinated. Anybody over the age of 18 is eligible to be vaccinated, and there are ongoing studies for younger populations going on at this time. If you have any questions, please reach out. I hope you will take these elements into consideration and get yourself vaccinated for both flu and for COVID-19. My last comment is that if you are looking for information, please consider the source. The best sources of information are going to be the FDA, are going to be the CDC, and are going to be the Minnesota Department of Health. Please, if you have other information, please vet it through those sources. There is a lot of misinformation going on right now, and we want to make sure you have the most accurate information possible. Again, reach out if you have any questions, and thank you for listening. I appreciate that.